All right. So when we're dealing with gluten intolerance and celiac disease, we're dealing with various aspects of human body. So first of all, we're dealing with metabolic problems. And so malabsorption of vitamins is extremely common, even among those who are gluten intolerant and on gluten-free diet. So a gluten-free diet is not curative. You need to take something else to fix your body. Pernicious anemia, or an autoimmune disease resulting in B12 deficiency, is extremely common. Iron deficiency, zinc deficiency, copper deficiency, selenium deficiency. And you can continue this list to probably another 20 or 40 elements which can be found deficient in gluten-intolerant patients. That's what I'm dealing with in my practice. These are autoimmune diseases which are frequently driven by gluten. So for those who are not very familiar with these conditions, so Sjogren's syndrome, it's an autoimmune disease extremely prevalent among women. So approximately 10% of Caucasians affected by Sjogren's syndrome after menopause. So this is an autoimmune disease which manifests in dryness, eye dryness, skin dryness, vaginal dryness in women, mouth dryness, extreme thirst. And the same disease can also cause joint pain, and it can cause chronic inflammation of the pancreas and chronic bronchitis. So the prevalence of gluten intolerance in patients with Sjogren's syndrome is approximately 70 to 80%. Most of you probably know what's fibromyalgia, which is a chronic pain without any underlying reasons. And in our clinic, success rate in patients with fibromyalgia is close to 60%. They go on gluten-free diet and supplements, and after 3 or 4 months, they become pain-free. Pseudogout, don't mix it with the gout. It's a condition when you have deposition of calcium crystals in your joints, and this condition is extremely prevalent in people after the age of 60. And again, majority of these patients and people, they have problems with calcium metabolism due to gluten intolerance and some autoimmune components. Osteoporosis, which is a common disease also affecting women, extremely commonly associated with gluten intolerance. Sacroiliitis, or inflammation of the sacroiliac joint, joints which connect your pelvic bones and your spine, also extremely common, especially among those who have HLA-DQ8. Dermatomyositis, it's an autoimmune disease which affects your muscles and skin. 90% of patients with dermatomyositis have gluten intolerance, and they can be cured with the diet alone. We have quite a few cases in our clinic. Psoriasis and psoriatic arthritis, it's another form of gluten intolerance. Prevalence of gluten intolerance among psoriatic patients close to 40%, and most of them also have HLA-DQ8 gene. It's based on our studies. I can continue this list again. We have patients with rheumatoid arthritis, lupus. We have patients with polymyositis. But again, just for general purposes, we showed most commonly seen conditions in our clinic. If you look on non-rheumatic diseases, this is another scope. So IBS, or irritable bowel syndrome, dermatitis herpetiformis, which is 100% celiac-associated illness of the skin, obviously celiac disease as an autoimmune disease due to gluten consumption, autism, bipolar disorder, secondary hyperparathyroidism. So this is disease of parathyroid gland, which results in abnormal production of parathyroid hormone and premature osteoporosis, attention deficit disorder, peripheral neuropathy. There are quite a few patients in our clinic with so-called autoimmune peripheral neuropathies who get much, much better on gluten-free diet and supplements. Seizures. There is a subset of patients with seizures who definitely have seizures driven by gluten. Schizophrenia. More and more data right now supports the fact that schizophrenia is a gluten-driven condition, as well as chronic fatigue syndrome. And again, this list obviously is far from completion. We can continue and continue and continue. So I'm not going to talk today about diagnosis of gluten intolerance because it's kind of beyond my presentation, but we'll talk about general approach to the treatment and how we can use supplements in our practice, and if you want to use it on your own, we'll help you with that. So first of all, it's elimination of gluten. That's the first step, but it's not enough. Most of the patients who have celiac disease and gluten intolerance don't feel normal on gluten-free diet. So the second step, it's a correction of metabolic disorders, and we're dealing with leaky gut syndrome, we're dealing with malabsorption of vitamins and nutrients, we're dealing with muscle wasting, we're dealing with osteoporosis. These are all parts of metabolic problems. The next step is a correction of immune responses. It is well documented that patients with celiac disease and gluten intolerance, even though you own complete, very strict gluten-free diet, so the immune system is still not completely normal. So people with gluten intolerance, they have long-standing problems with low mucosal immunity driven by immunoglobulin A. They have low level of NK cells. They're very prone to various chronic infections such as mycoplasma, chlamydia, Lyme disease, and so on and so on. And so correction of immune responses is the next step. And finally, it's a tumor surveillance. As I mentioned before, patients who have gluten intolerance and celiac disease are prone to lymphomas, so they're prone to colon cancer and pancreatic cancer. And so tumor surveillance is another vital part of treatment and surveillance protocols.